Okay, let's jump into something that maybe sounds a bit like science fiction, but it's actually quite real. Air or gas embolism.
Right. We've been digging into the research, the source material on this, especially looking at hyperbaric oxygen treatment.
And our mission here really is to pull out the key points for you listening, whether you're just curious, maybe dealing with this yourself, or supporting someone who is.
Exactly. We want to find, what the sources agree on, what really matters according to the research.
Okay, so let's start right at the beginning. What is a gas embolism? I saw terms like arterial and venous.
Yeah, simply put, it's gas bubbles getting into your blood vessels where they shouldn't be. Think of your blood vessels like roads.
Okay.
These bubbles are like unexpected roadblocks. Arterial gas embolism means the bubbles are in the arteries, the roads carrying oxygen-rich blood from the heart.
Got it. And venous.
That's when they're in the veins, the roads bringing blood back to the heart. So different routes, potentially different problems.
What really struck me from the sources was how this happens. It's not always some, dramatic diving accident.
No, not at all. That's a key takeaway. Well, things like rapid ascents in diving, or even older stuff like submarine escape training, are known causes. The sources show it's broader.
Like what kind of things?
Well, certain surgeries, definitely,
Yeah.
but also sometimes medical injections if air gets in the line. That was mentioned.
Really? Just from an injection?
It can happen, yeah. And one thing that surprised me in the research was accidental ingestion of things like, believe it or not, hydrogen peroxide.
Wow. Hydrogen peroxide. How?
It can apparently release gas inside the body. And the sources even mention air just sort of passively entering surgical wounds, especially if the wound is physically higher than the heart. Air can get drawn in.
Huh. So much more varied than I thought. Okay, so these bubbles are causing blockages. What does that feel like? What symptoms did the sources describe?
It really, really depends on where those bubbles end up and how many there are. Arterial is often the more immediately serious one, especially if bubbles go to the brain.
Makes sense.
The sources talk about really sudden acute symptoms, things that can look a lot like a stroke confusion, maybe paralysis on one side, seizures, even losing consciousness. It's serious.
Because it's cutting off oxygen, right?
Yeah.
To the brain or other vital areas.
Exactly. It's a direct blockage. Now, venous gas embolism, that can be different. The symptoms can vary a lot more.
How so?
Sometimes, if it's a lot of gas, it might cause breathing problems, like a cough or shortness of breath. But interestingly, the sources point out that small amounts in the veins might actually cause no symptoms.
No symptoms at all. Why?
Because the lungs can sometimes act like a filter for small bubbles arriving via the veins, trapping them before they can cross over into the arterial side and cause bigger problems.
Ah, okay. The body has a bit of a backup system there. So if this happens and someone does have symptoms, what's the plan? What did the sources say about treatment?
Well, first aid is key.
Yep.
The basics. Make sure the airway is clear, support breathing, circulation, give high concentration oxygen right away.
Standard emergency stuff.
Right. But the main treatment, the one the sources really zeroed in on as the definitive therapy, is hyperbaric oxygen, HBO.
Hyperbaric. High pressure. Right. How does putting someone in a high pressure oxygen chamber fix gas bubbles? Seems counterintuitive almost.
It does sound a bit strange, but the physics works. The sources explain it clearly. The higher pressure in the chamber literally compresses the gas bubbles. It shrinks them down.
Like squeezing a balloon.
Exactly. Makes them smaller, less obstructive, maybe even helps them dissolve back into the blood. Plus, breathing pure, 100% oxygen under pressure, floods your system with O2.
Ah, so it helps deliver oxygen even around potential blockages?
Precisely. It helps compensate for any oxygen deprivation the tissues might have suffered because of the bubble.
And the sources seem pretty unified on this, didn't they, about hyperbaric oxygen?
Oh, remarkably so. It was presented as the standard of care, the definitive treatment for arterial gas embolism, and also for venous gas embolism if it's causing significant symptoms.
And they gave it a strong recommendation.
Very strong. The sources use the term Class 1 recommendation.
And just so you listening know, Class 1 is basically the highest level. It means there's really strong evidence and expert agreement that this treatment works and should be used.
Couldn't have said it better. It's a top-tier recommendation based on the evidence. And the other thing the sources just kept emphasizing was time.
Getting treatment quickly.
Urgently. Getting the person into that hyperbaric chamber as fast as possible was highlighted again and again as absolutely critical for a good outcome.
Which brings us to outcomes. What did the sources say about how well people recover with this treatment?
Generally encouraging, actually. The sources report that many patients can achieve a very good recovery, sometimes even a full recovery, with timely hyperbaric oxygen.
But not always.
No, it's not magic. The outcome really depends on things like, how bad the embolism was initially, which organs were affected, the person's overall health, and back to that crucial point, how quickly they got treated. Speed is paramount. That came through loud and clear.
So this deep dive really shows how something seemingly simple, just a bubble of gas, can disrupt our body's intricate systems in some surprising ways.
Absolutely. And how critical the right intervention delivered quickly can be. The sources are quite definitive on the role of hyperbaric oxygen here.
It really paints a picture of this delicate balance inside
It
us.
really does.
So a final thought for you, our listener. Considering how these tiny bubbles can cause such major issues and happen in ways maybe you didn't expect, what does this deep dive tell you about the incredible fragility, but also the resilience of the human body and the real power of timely informed medical care?